Hello, everyone. My name is Donaldson Conserve, and I'm an associate professor at the George Washington University School of Public Health in the Department of Prevention and Community Health. And I'm also the founder of the Black Male Professors and Researchers Collective. And today we have the pleasure of interviewing a PhD student who's at the University of Maryland, starting, I think, in his second year or completing his second year, if I'm correct, but he'll definitely be sharing more. And part of this series is called Black Men Pursuing PhDs. And we are hoping to inspire young Black men and any other group of individuals who are interested in pursuing a PhD or thinking about a PhD. And if you haven't subscribed to our channel, please do so now so that you can continue to receive great interviews like this one today and the other ones that we have already posted. So please subscribe and hit the like button and share with friends or your colleagues who may be thinking about pursuing a PhD or are currently in a PhD program and looking for support. So now I'll pass it on over to Chiti to introduce himself.
Good morning, good afternoon, everyone. My name is Chiti Bwalya. I'm from Zambia, and I'm a second-year PhD student at the University of Maryland in the Department of Behavioral and Community Health Sciences. Yeah.
Wonderful, wonderful. And Hassim, please introduce yourself.
Yes, hello everyone. My name is Hassim Diallo. I graduated University of Maryland last year, 2023. So yeah.
Wonderful. Well, what did you major in, just to share?
My major was public health science, and yeah, just major public health science.
Wonderful, wonderful. And Chiti, you said you are doing your PhD in the Department of Community and Behavioral Science. Is that correct?
Community and Behavioral Health Sciences, yeah.
Behavioral
BCH.
Health Sciences, CBA. Wonderful, wonderful. So maybe we could start about what made you become interested in this PhD program.
Well, so as you know, I'm from Zambia, and my undergraduate training was in social sciences, and just after finishing my undergraduate, I started working for a research organization in Lusaka dealing with HIV research and programs. And from there onwards, my work was mostly related to research and community-related work. And I've always been interested in dealing with communities and people, and I wanted to improve myself with regards to how research is done, how research is designed, how research is implemented. And for a long time, I was, busy looking for opportunities for me to do a PhD. And when I joined this organization I was working for, where I worked for like a good 7-8 years, from there I did a master's in public health from South Africa, so as to improve my understanding of research. And then that experience of doing a master's in South Africa and also working for an organization dealing with HIV, community-based interventions, gave me the edge to start looking for opportunities to do a PhD. So I left that organization and joined another organization that is affiliated with the University of Maryland. And that's how I came to learn about the program that the University of Maryland offers. And when I looked at the program and what I was doing and what I wanted to do in the future, there was a very strong alignment. So like I mentioned, I was dealing with community health, and the PhD program at the University of Maryland is behavioral and community health. So there was a very strong alignment with regards to what I wanted to do and what I was learning. So then I became interested. I was taught a little bit more about the program. Then I became interested, started doing some more research. My mentor at the time introduced me to one of the students who was a BCH student, and she gave me more insights into what the program is all about. I also went online, looked at the website, got more insights, and from there on, I was like, oh, this is my program. And I started the application process, and here I am.
Wonderful. This is my program. I like that. The conviction that one can have when you see something that really speaks to you. I can actually say the same thing when I was looking at the PhD program that I ended up going to at Penn State University in biobehavioral health. I felt the same thing. I felt that this was it was a calling and I applied and I reached out, and thankfully I was accepted.
Yeah.
So for the purpose of just naming places and organizations and a little bit more about your research, can you share what school you did your undergrad in, and how did your time in your undergraduate career help you become interested in research? And then what the name of the organization that you went to work for after that, and what exactly were you doing as part of community health research?
Okay. So I did my undergraduate degree at the University of Zambia. I graduated a long time ago, 2008, 2009. And just after graduating, I got a job as UNV for the United Nations High Commissioner for Refugees. So basically, my job there was to help with repatriation of refugees. So we were working with Congolese refugees at the time. So we were helping them get back home. And then from there onwards, I was moved to another department, which was dealing with, urban-based refugees. So I worked for UNHCR for like 2 years and some months. Then I saw a job ad in one of the newspapers for an organization called Zambart in Lusaka. So at that time, it was Zambia AIDS-related TB. And they were looking for research assistants with a degree in social sciences. So I was interested in research. So I applied for that position as a research assistant, and I was interviewed, and I was fortunately selected to work as a research assistant. So I started from the entry level, doing qualitative research. And from there onwards, working for Zambart, I learned quite a lot of things with regards to research, from, data collection, designing of data collection tools. Then as I worked more in the organization, I began to now rise up a little bit from just a qualitative research, a junior qualitative research, to a middle management kind of a researcher. Towards the end, I ended up getting a bit of funding to do some work. You and I worked on the HPTN program together. And I learned quite a lot. I always say that most of the things that I know about research, I learned it from Zambart. Zambart gave me the base and the foundation to really understand research. So after working for a couple of years within Zambart, I was fortunate enough to get a place at the University of the Western Cape in South Africa, where I did my master's in public health. So my MPH was a part-time MPH. As you know, where I come from, it's very difficult to find funding for your school, for your master's or PhD. So I was fortunate enough that within Zambart, they had a grant that had a small budget line for career development, and Zambart paid for my master's. And through that master's, my master's took long, 3 years or so, because I was evaluating an intervention that I had to wait for about a year to, run and then do the evaluation. So once I was done with my master's at the University of the Western Cape, I continued working for Zambart until 2021, when I moved to another organization called Maryland Global Initiative Corporation. So in short, MGIC. So MGIC is an affiliate of the University of Maryland School of Medicine in Baltimore. So there I joined there at a much senior position as a research coordinator. And my job basically was to help coordinate NIH grants, and also they were doing evaluations of different programs, HIV programs that they were implementing. So I started working for MGIC 2021, did a lot of evaluations of DREAMS, a component of DREAMS. We were implementing 2 NIH grants dealing with advanced HIV, and also did a lot of coordinating IRB work, application for approval, making sure that we have all the approvals we need, making sure that staff are trained with all the requirements with regards to ethical requirements. Then it's the time that I was working for MGIC that I came to now learn about the University of Maryland in College Park. At that time, I didn't know there were 2 distinct, colleges or campuses. Then, as I was working, doing these evaluations with my PhD, who's my PhD advisor now, she taught me about the program. And she's like, if you're interested, you can also try and look at this program. And then she also introduced me to other students as well. And that's how I started talking to other students, and I started to look at the program, and I applied. And fortunately, I was given an opportunity to come and study. So then the 2022 August, I came and started the program, and I started working part-time in Zambia. I was working part-time in Zambia, and whilst I was doing my PhD program, I was fortunate enough that my supervisor was able to be flexible enough to allow me to go for this PhD, but at the same time continue doing my work. It was a challenge, PhD work and school, and then also I'm also a teaching assistant, so I had to juggle three things, and that made it a little bit much more challenging. But then so from there onwards, managed to finish my first year, and now I'm in my finishing of my second year, heading towards my qualifying exams this coming July, and hopefully I'm successful and I'll move forward with the program.
That's amazing. That's amazing. I as a researcher myself, I was very excited to to hear more detail about the journey that you took from finishing undergrad, starting working with refugees, and then starting as a research assistant. I think that's where the research world probably opened up for you and kind of give you a chance to start learning from as small as maybe data cleaning or whatever you may have been doing at that lower level, to moving up slowly and surely and learning all of the different phases of research to the point where you eventually went for your master's, completed your thesis, and then working for this new organization that gave you access to come to University of Maryland. And one thing that came to mind as you were talking is that the journey to a PhD is not linear. It varies for different individuals, and you had a good number of years to really solidify your interests and develop your skill set to make you a very desired and competitive applicant for the PhD at University of Maryland. So I think, a lot of people have different paths, but you took your time. You didn't, necessarily rush the process. So thank you for sharing. I'm going to ask Hassim if he has any questions based on what you've shared so far.
Yeah, I was just gonna ask right now. So you said that you were doing a lot of, working and school at the same time. So typically what were like your working hours like? So obviously you'd have to study for school, you would have to do your research, and then obviously you're part-time at the different organizations. So how did that, how did you juggle that?
That's a good question. I think I don't think I can indicate that I was working this number of hours. Like we always say that in our field, there's no knocking off. Like you can work anytime. And I had a strong team. I had a strong team of people that I work with below me and also above me that were able to support me. So when I left, I left one person in my place to really help me do the day-to-day activities that I used to do. And then myself and him would communicate frequently on how things are going, and I would support him and provide him with a bit of technical support. So so the advantage that I had during my first year, most of the things that I was doing in terms of coursework was very much similar to what I did for my MPH. So it was more like revision, and I wasn't spending so much time with my coursework, so I could juggle between my work and school, and that really helped. And this year is a little bit different. This year has been a little bit tougher compared to first year. First year was much more easier because the courses I did at masters were the same courses that I did at MPH and also at PhD level. So that really helped to, with my juggling between my work and also my school and also my job as a teaching assistant. So, so I think it was just a matter of working long hours and planning, and also just making sure that you stick to your plan. Because the other challenge is the time differences. When it is, let's say, 8 hours here, is either 14 hours or 13 hours if time has not changed in Zambia. So the other thing that really helped me was when it gets to 12 hours, then people in Zambia have already knocked off. So meaning what I used to do was I would focus on my work in the morning when people are still awake and are still working in the afternoons in Zambia. Then when it's 13 hours here, then I would focus on my school because there's nobody working in Zambia. Everybody has knocked off because it's after 17 hours. So that time difference also works to my advantage as well. But otherwise, I think it's challenging. The fact that the program is full-time, you have to do coursework, but you just have to find a way of making it work.
Okay. Yeah, thank you.
Yeah.
Thank you. And I think that also comes with the fact, like you said, you already did a master's, and when you were doing your master's, you were working part-time or full-time as well?
I was working full-time as well, yeah.
Okay.
So the master's was designed for part-time people that are working full-time.
Okay.
Was a
So
part-time
you were
master's.
able to juggle that. And how did you choose the master's program in South Africa? Was it part of the Zambart program, or did you have the flexibility of choosing where you wanted to go for your master's?
Well, I wouldn't say I had the flexibility because I was looking at where I could find funding for the program, right? And so my supervisor at the time, Professor Bond, was trying. We tried so many different avenues. We tried with a London school. We tried with Stellenbosch University. And I think I came to learn about the University of the Western Cape when we were in South Africa for an analysis meeting. We were doing some analysis work with a team because we worked hand in hand with the social science team at Stellenbosch University. And I think that's how I came to learn about the program. I can't remember exactly how I learned, but I think I came to learn about it that way. And from there onwards, we then started to apply for the program. And unfortunately, it was a very competitive program because the pricing for it was much more fair compared to other universities. So we managed to get a place with a colleague of mine, and that's how we started. But now the fact that we were qualitative researchers, we wanted to improve how we do qualitative research, and I decided to major in qualitative methods. So my master's was purely qualitative. I took one quantitative course, which was an introductory course, but the rest of the courses were qualitative courses. So when I came here, most of the introductory courses to public health, we covered those in my master's, but what we didn't cover in detail were the quantitative courses. So in my second year of my PhD, I take many quantitative courses. So most of the things I'm meeting them for the first time. And so the BCH program is heavily quantitative, and I'm meeting most of the things for the first time. And that comes as a challenge, but at the same time as an advantage, because you kind of learn a lot, the things that you didn't know when you get a quantitative paper, you look at it like, oh, I didn't know this, now I know. And then you gauge yourself that, oh, I'm learning a lot. And also, I've always been interested in doing mixed method research. And the fact that the BCH program has so many quantitative courses puts me at an advantage. So when I look at the program, I feel like I'm learning more of quantitative because I don't have that much expertise in it. I have quite a lot of qualitative research. So that's where things are at the moment with where I am.
Thank you. Thank you. Any question, Hassim?
Off that note, I'm good for now. Yeah.
Okay. Well, I'll just, share. Hassim has actually conducted some qualitative research with my group here at GW, and he's a co-author on the paper we published. So I think one of the reasons I was excited to have him join us for this interview is because he has been exposed to research with my team focusing on COVID-19 perception, COVID-19 self-testing perceptions among African Americans here in the United States. He helped out with the qualitative data collection, and he helped connect us with people in Maryland. We interviewed for the project, and then he helped with the data analysis and the writing of the manuscript. So so when you mentioned qualitative research, I was thinking that, Hassim is probably definitely aware of what you're talking about. So that was very exciting to hear. Now, I do know a little bit about your research, and I was wondering, you've touched upon refugee health, HIV/AIDS. I was wondering
Yeah.
if you could spend a little time describing what the research project was that you worked on for your master's program, that you evaluated for the intervention, and then if you can also expand that, or maybe it is included, the HIV Prevention Trials Network fellowship, scholarship that we both received. I was for the domestic one in the US and you were the international scholar or one of them.
Yeah.
So if you could tie us, your experience for your master's specifically, and then eventually HPTN altogether, if they are the same.
Okay. All right. So in 2011, so Zambart, the organization I used to work for, got funding to implement the HPTN 071, the PopART trial. And so when they got funding, my supervisor at the time also got some additional funding to do some formative research work for the PopART, some qualitative formative research work. So then that's the time I was recruited as a qualitative researcher to do formative work for PopART. So before PopART started, we were doing this work to understand the communities where the trial was to be implemented. What were the barriers that might exist when we start to implement the trial? What would be the facilitators of uptake of the trial? So I started to work as a qualitative researcher in 4 communities based on the Copper Belt north of Zambia, where I was born. And I think I was given those sites because I speak the language. As you know, in qualitative research, language skills is cardinal for you to interact with communities. So my work was to basically help implement the formative work for PopART, did a whole lot of interviews, did a whole lot of observations, community observations, clinical observations, to really understand how these communities were set up, the norms, the values, what is it that is in these communities and what can make the intervention work. And then once we were done with formative work, we then moved into now working as social scientists on the HPTN 071. We had what we were calling story of the trial, where we were documenting how the HPTN 071 was implemented. So for the record, so the HPTN 071 trial was trying to evaluate the effectiveness of the door-to-door HIV testing and linkage to early ART on community-based HIV prevalence. So we wanted to see if we were to go door to door, test everyone, and those that were testing HIV positive, link such individuals to early ART, can that lead to a reduction in HIV, reduction in the prevalence of HIV at community level? So to implement that door-to-door intervention, we had to understand, the community itself. What type of people live in these communities, livelihood options, when do they leave their households, when do they come back? So that was covered through the formative work, and then the intervention started, and we were working as social scientists collecting data on so many different research questions. So the trial was a very large and long trial implemented in Zambia and South Africa. And I worked as part of the social science team in Zambia, and then there was also a social science team in South Africa at Stellenbosch that we worked with together, doing the same stuff. What we're doing in Zambia, they were also doing in South Africa, and would meet frequently to really discuss progress. And as the trial progressed, I think in the second year of the trial, I think towards the end of second year, the leadership of the trial observed that we were missing out a lot of men. Like, men were not being tested for HIV. And of course, as we know, most men are never found in their homes because they go for work, they have to go into their businesses, etc. So then they got additional funding to try and implement HIV self-testing at the time, to see if HIV self-testing can really help improve uptake of testing amongst men. And I was privileged to work on this small component of HIV testing, intervention within the main trial as a social scientist. And then from there onwards, there was another sub-trial within the main trial, which was being implemented by another PhD student. And he was trying to understand if the use of community models of art, differentiated care can improve adherence amongst patients initiated on early art. So I worked as a co-investigator on that sub-grant, which was part of his PhD, and then I decided to use that sub-study, which was looking at differentiated care, as my master's research. So my master's research was basically evaluating how acceptable is the home delivery model of ART in communities. I wanted to understand, because where we do work, there's a lot of stigma. So I wanted to understand, can a lay counselor delivering ART in people's homes, can she be accepted by the people that are receiving the ART? So I decided to do a qualitative evaluation of that model to see if it was acceptable. And yeah, and that's how my master's topic came into being, and I successfully managed to do my work and handed in my dissertation, and then graduated, and then moved on to work on some other programs that came along.
Wow, very exciting. I used to, well, as you may know, I work on HIV self-testing in Tanzania a lot, and one of the models we have been exploring to implement is actually home delivery or community-based delivery of ART, and now PrEP for individuals who self-test for HIV in Tanzania. So I used to pay attention a lot to the PopART study in Zambia and looking at the papers that were being published. Very exciting results, because that's the direction I wanted to also go for my project in Tanzania. So it's a pleasure. It's a very exciting to be talking to you directly as someone who was involved in that project, and will definitely be following up with questions afterward. But Hassim, before we continue, do you have any questions about all these exciting different projects? Yeah. Okay.
Yeah. So specifically, so when I was doing, as the Dr. Conserve said earlier, I was doing also qualitative research for STEP, and just wanted to ask, what were your did you have any difficulties, since HIV and like sexually transmitted disease is kind of taboo, and I know especially in Africa, did you have any difficulties like gathering data? Because you said a lot of men at first weren't responding because they were at work, or do you think, like, what do you think were specific like reasons why, or if you had difficulties like gathering data for your specific project?
Yeah, I mean, challenges were there. As you know, communities are different. Communities have different values, and most of the time, we as researchers, especially if there's no community engagement, we are intruders with questions. Going to disturb people that are peacefully living, right? And in the name of research. So challenges will always be there, especially if you don't engage the communities. So some of the challenges that we faced, of course, were people would refuse to participate. They just don't want to participate, and you can't force them. So you would try and explain, they would just refuse. That's one. Then there were also a lot of misconceptions around the work that we were doing. So to evaluate the PopART intervention, we had a team of nurses that were drawing blood, and then this blood was being used to test. So we had a sample that they would go, and a sample of people that they would go and collect blood from, and then they would take the blood to the lab, and then they would do the test. And it was this blood that we used to evaluate to get to know the prevalence of the HIV in the community. But now for community members, seeing that we are drawing blood, they had all sorts of conclusions, and that created a lot of challenges for us. So we had to do a lot of community sensitization and engagement. And also we had colleagues that, community engagement experts. They had community advisory boards they would work with to make sure that the community advisory boards get to understand what the blood is being used for, and then they would go back and explain to the communities what the blood is for. And that really helped. From a qualitative research perspective, one of the challenges that we faced was, like you mentioned, talking to people about sensitive topics, like, for example, STIs, and because we were recruiting people from different ages, I was a young man at the time. I was in my 20s. And if I'm being asked to go and talk to a person about, when was the last time you had sex? I'm talking to an older woman who's the same age as my mother. It's a challenge for me as a researcher. And so it's our cultural norms, the intersection between our cultural norms and the research itself and the sensitive questions made it a little bit much more challenging for me or my other team members to really collect data. And also just other research topics that have to do with, for example, oh, what type of sex were you having? Those are very things that people in my communities would never talk about for cultural reasons. So also the other challenges were, most people, when you read a qualitative paper, you would think it's easy, right? It's easy, you can easily write it. But
Yeah.
to write a qualitative paper, the process is tiring. So you would get tired. So when I'm in the field doing observations, when I get to my guest house room or hotel room, I have to start writing whatever I was doing because I'll forget. So that was tiring. So that was also another challenge. It's tiring. It takes up so much of your time to transcribe, to write a detailed observation. That takes a toll on your body. I always say that for you to be able to do qualitative research, you have to love it to do it. If you don't like it, you can never be a good qualitative researcher. You have to be motivated by your inner person because you just love to do this. So there were quite a number of other challenges emanating from language barriers, cultural values, and also in some settings, especially in South Africa, safety. Safety was a big issue. In Zambia, we never had such problems, but our colleagues had very big challenge with safety. Just moving in the community with your recorder and your bag with your laptop, that can pose a threat on you. So
Yeah.
there were some of the challenges that we experienced.
Yeah, thank you.
Very, very good question. You have another question, Hassim?
No, you go ahead.
Yeah, the description of qualitative research, the challenges of doing qualitative research. Again, we went through some of that here with the project STEP. STEP means self-testing for education and promotion that Hassim mentioned earlier. So that's the STEP project. We used it both for HIV self-testing, but also COVID-19 self-testing here in the US. And it's very difficult to get individuals to agree to participate, I think, regardless, whether it's in Zambia, Tanzania, South Africa, and then also, of course, cultural norms and cultural values. But the love that you mentioned at the end makes a difference. And I think that when you have a love, for me, just to share, the love for research actually stemmed from my experience in South Africa. I did a summer internship in South Africa with the Desmond Tutu HIV Foundation at University of Cape Town. And then from there, during the summer, we would go to the community and learn and spend time. I wasn't even collecting data, so that I didn't really get exposed to that challenging aspect. I was part of the Tutu tester. They have a mobile van that goes out in the community to provide HIV testing as part of the program, not part of research. So that kind of exposed me to the communities and created a desire for me, to want to spend more time in the communities that I work in, whether it's in South Africa, Tanzania, Washington, D.C., Haiti, where I come from. So I think that's what I was going to ask you was, if it's so challenging and so difficult to do qualitative research in these different communities, what keeps you going besides just the love for it? Like, what has kept you going? And now you're going to do a PhD. Maybe there's qualitative research involved in this PhD that you're thinking of, doing for your dissertation. So can you tell us a little bit about what keeps you going besides just the love?
Well, I think the interest and the love is a bigger part of it. And I mean, I would say it's the satisfaction you get from doing this. I always say that if you had to get me a job in a bank and pay me so much money, I don't think I can be satisfied because I'm not built for that, right? And I think you draw a lot of inspiration and a lot of satisfaction with just interacting with people. I find that interesting. You create so many networks with people. You will learn so much from people. Just because somebody doesn't have a PhD or is not an associate professor doesn't mean they don't know things. There's so much that you can learn. And through my work working with communities, I found that actually there's so much knowledge there. There's so much knowledge that I can get from people, and that makes me a better person. So my interest has always been to just really learn, be open-minded, and learn from different communities. So one of the things that I love doing when I'm not working, if, for example, if I travel to a different country, is to go and look at how people live, drive through their households, like drive through their neighborhoods, just to see how their houses are structured, how their communities are structured, because that makes me become much more knowledgeable and open to know about more other cultures. So same applies to communities. So getting to know how the community is structured and how things are organized, I just find that interesting. But also, I've always been interested in teaching, and I always feel like once I get to know most of our communities and the challenges they face and what programs we can do to really improve people's lives, that can impact my way of understanding and implementing a research teaching methodology in the different institutions that I work with. So basically, it's a whole lot of things, but most of it spans from just having fun while doing it. Because if you don't have that, then you won't enjoy it.
Thank you. And what you just shared toward the end there helped kind of motivated me to think about your transition to the United States. You came just for the PhD. I think, well, you came prior to the PhD. You and I, we met when we came for the HIV Prevention Trials Network conference in Washington, D.C. So you came during that summer and had a chance to, see the U.S. Had you been to the U.S. before that meeting?
No, that was the first time. That was the first time.
Okay, so at least you had that first trip before you started. So you came, I think, June or July for the conference, and then you came back to start the PhD program in August. So if you could walk us through the preparation for that transition to the United States, challenges, successes, settling in, finding a place to live, balancing a budget of a PhD student while you have a family back home. Thankfully, you're working part-time. So, can you walk us through that transition for the first few months into the PhD and also into the United States, leaving family behind? Yeah.
All right. So I'll take you backwards. So I think 2021 is when we got the funding to do some additional secondary data analysis on the HPTN from HPTN. So I was working on secondary data that we collected from community health workers that were implementing the HPTN 071 trial. And I was trying to understand their experiences of going door to door, doing this HIV testing and linkage of people testing positive to ART. So then when we met in the US, I think we were just trying to present our work. And then I went back home. And then at the time, before coming here, my wife was away. She was away doing a master's in the Republic of Ireland. So I was alone for a year without her, and I was just with my kids. And that's the time COVID hit, and so most of the time we're working from home. So I would be working, and my kids would be seated next to me, and they're doing other things. And eventually, COVID came to. There was a reduction in the number of cases, and things came back to normal. And thereafter there was the AIDS conference in Canada. So then I took advantage of that conference, traveled to Canada for the conference, and then from Canada I came straight to the US. So I was in the US 1 month earlier before school started, but that was an advantage because it gave me enough time to look for a house and the like. And I was fortunate enough that I have my wife's relative lives in Maryland, so I went to stay with her. For about a week or so. She helped me look for a place, and I was fortunate enough to find a house very near to the university. I just used a bike. I decided not to buy a car. I was like, I'm going to use a bike. So I just used a bike for health reasons. And so my transition, I think, was not so rough. It was okay. It was very hot at the time, and I felt like the same as it is, but I think it gets hotter here than back home. So, and I think yeah, so when I moved, I was able to find a house, was able to walk around before school started, and the program started, and it started getting busy. And 1 month later, my wife finished her program, and she went back home to be with the kids. So I think what happens is the way so I supported her to go and do her master's, and I remained home, and then she also is supporting me to do this program while it's looking after the kids. But what I've done is I've always made sure that I go back home during the breaks, for my own sanity, but also just to see family and also to just make things much more normal. And so living in the US is, I think, has been okay for me so far. I can't complain because I live very near the university, and I don't do anything else apart from my program. Um, of course, I would go a few places, but most of the time I hardly have time to go elsewhere because the program is quite demanding. Um, so for my sanity, I talk to my kids on a daily basis. So having, Zoom or WhatsApp video calls just brings that sanity back into my life. When I talk to my kids, talk to my wife, I also talk to my friends. I also have my roommates here. I live with two other PhD students in the same house, and that makes it much easier. But then also, I think just being busy with school and work makes time move fast. By the time you're turning around, you're going towards the end of the semester, you go back home, spend some time back home, and then you come back. So that makes it, I think going back home and coming back for a new semester makes it much lighter than staying for the whole 4 or 5 years. I think it would be much more challenging. So yeah, basically I think everything seems to be okay, and my advisor has been very supportive. She would invite you to her house, you go meet with her kids, you see, chat, and also the department is also very supportive. They would tell you about different things that are happening. And I've got a very super supportive class. So we have 8 PhD students, all my classmates, and they're really, really nice people that makes it much easier for you to be in the program. If you are stuck with anything, you can consult, they would guide you. And if you need, anything with regards to, oh, how do I do this in the US? They will be able to help you. How do I do my taxes? They will show you. So yeah, I think the bigger part of it is having that supportive environment, or it's a very good support network that makes it much easier for you to transition smoothly back. But then also, if financially feasible, just going back home for me makes it much better, because I look at the semesters and I don't look at the whole program. I look at, oh, I'm here for 4 months. Once the semester ends, I go back home, work, then come back again and continue. That really, really helps.
Thank you. Thank you for sharing that part of your journey. I think a PhD program in general, whether you're doing it in the US or Zambia or anywhere else, is challenging on its own. So having to transition from another country, balancing, family life to make things work here in the United States. So it's something that I'm sure if anyone is watching and who's considering coming to the US from somewhere for a PhD or going to another country, this might be helpful, balancing the work and life balance, thinking about it in a semester format, and taking breaks to go back home, and having a good social support where you are, having a good advisor. All those definitely make a big difference. I'm gonna let Hassim ask a question if he has.
Okay. Yeah. Just specifically, so between so you did your undergrad and you did your master's in Africa, and then you came here to do your PhD. So obviously your master's, you start to do a little research, and then your PhD, it's just, another level of that. So between the two, like school systems, like how much freedom um were like if does the American school system grant you more freedom in terms of research compared to the African school system? So essentially my question is like how much freedom do you have within your research at the United States, and also how often do you meet with like your mentors and your specific advisor about your research?
Okay. So So our PhD program is structured in such a way that for the first 2 years and a half or so, you do coursework. Okay, you do. I take three credit courses and one credit course. That's 10 credits every semester. And then I also work 20 hours as a teaching assistant for a biostatistics undergraduate class. And then also, I also work on research with my advisor. So we have a couple of research that we do in Zambia. And so the freedom, so first of all, the coursework takes up so much of your time. That's one, because in each and every course, you have assignments or homeworks, as you call them in the US. Homeworks, you have, some have exams, you have projects that you're working on, you're designing interventions or evaluations, whatever that the course is asking you to do. Then you also have readings, you have to read articles and all sorts of things. So that takes up so much of your time, of course, which is the reason why you're doing the program, and it's extremely important. Then I also work on other research activities. So the program, despite the program being busy with so many things, you still have a bit of time to work on other things. So you have to find a way of making sure that you work on these other things. You have to work. I'm working on a couple of papers here. I'm working on designing another intervention here. Or coding data. So you have to find time to really do this work, because that also helps you put into practice whatever you're learning, right? Then I'm also a teaching assistant. I have to do the grading. I have to help my professor prepare the homeworks, prepare the slides. And so all these other things have to fit within, the 1 week that you have. So you have to find a way of making it work. So the difference is that in the African system, so for example, at undergraduate, I was a young person. I never had a job. I was just going to class and come back and play. That's it. At master's level, I had a job and school, right? So the difference is that here you have so much to do. Okay, not just school, but other things related to your work or your teaching assistantship, and that also consumes a bit of your time. So the education system is similar in a way, but that's the structure that is a little bit different. Of course, I don't know how other PhD students in other countries that are not, because for example, if you go to South Africa, I have colleagues that are doing their PhD in South Africa. They don't take first or 2 years of their program take courses. They just go straight into their research, and then they take additional courses they feel they need, or if they feel they lack a certain skill, they would take those courses. So I would say maybe that gives them a bit of more time to focus on their program in their first year or so. But here for the first year or second year, you have no research topic at all. You focus on getting grounded in different methodologies that then when you start to do your dissertation research, you can now focus on that. So I wouldn't say there's a big difference. It's the same system. It's so dependent on what program you're doing and how much work you have in that program, which dictates how much time you will have at the end of the day.
Okay. And just my second question, just based off that, is how often do you meet like your advisors and your mentors, within the week?
So we used to have like specifically for the program, we meet depending on how busy she is. So first of all, there are different ways I communicate with her. We communicate via WhatsApp. She calls, I call her. We also communicate a lot via email. But for PhD specific meetings, depending on the semester, we might meet bi-weekly or once in a month, right? But because I also work with her on other programs, we meet very often. Maybe in a week, I would just bump into her office and just to say hi and we chat. So I wouldn't say we have a specific time that we meet. We meet as many times as I need support, or if she needs me to help her with some things. will meet. But for the PhD program, we discuss it's okay for this year. Can we meet bi-weekly, or do you think we should meet just once? So depending on that. But for work related, we meet much more often.
Okay. Thank you. Yeah.
Thank you. Thank you. Those are great questions. I think the last question is really if you can share some tips for someone who's considering a PhD. Maybe they're working full time, maybe they're in Zambia, maybe they're in Nigeria, maybe they're right here in the United States, like Hassim, who's thinking about going for a master's program and may end up considering a PhD if that's part of his interest, right? What would be some key takeaways you would want someone to take from this interview at a global or even local level?
Yeah. Well, I think the first thing is you have to know what your future plan is. What do you want to do with your career? Are you interested in research-based work? Are you interested in teaching? What are you interested in? And if you are if you are an undergrad, if you just graduated, I think I would advise you to get a bit of experience, research experience. You need to do some work, preferably start at the lowest level that you can start as a research assistant, collecting data, doing data analysis. And then once you get a bit of experience, a year or two, if possible, then you can do your master's. Because as you know, a master's informs or makes you, to some extent, a specialist in a certain area. Right? You become a master in a certain area, and that should build on your work experience, the type of work that you're doing, and top up on that a bit of, add a master's to that. Then from there onwards, some people will end at a master's and they'll be able to do great things. But if you want to be an independent researcher, then you can go for a PhD. And I think what is extremely important is, as you're doing your master's, or after you finish your master's, work for some time if possible, get into publishing if possible, work on a paper or two, learn the art of writing, learn the art of lit review. It's always that puts you at an advantage, and then also, like I mentioned earlier on, what is it that you want to do in the future? And do you think having a PhD will add value to what you want to do, or do you want to end at master's level? Because so many people, for example, wants to do their PhD to come and evaluate a program. The PhD is not just about evaluation. The PhD is much more broader than that. You have to, they are training you to become an independent researcher, and it requires, you need to ask yourself, am I the person that can sit the whole day looking at my screen, reading and researching? Are you really interested in that? And then if you answer yes to those questions, then you have to start to prepare for the journey of application. The application process is also a very lengthy process. You need to get good recommendations. You need to have 1 or 2 publications. That really helps. So meaning you have to set yourself up. So if you're applying for a PhD next year or in the next 2 years, you start to prepare for it. Can I get on a publication this year? Second author, if possible, first author. Then you need to start to build up your network of recommenders who can write a very good recommendation for me. Then you start to apply, and then the application process, you don't want to start it a month before. It's a lengthy process. You start it months and months before, so that you can have a good application, and you also give your recommenders enough time to really write your good recommendation. And yeah, so basically for me, I think in a nutshell, it's all comes down to individual plans and where you want to see or what you want to do in the future. And if you really want to be an independent researcher, if you are interested in teaching, if you enjoy spending most of your time researching and reading, then a PhD program is good for you.
Wow. Wow, that was amazing. I think you are ready to mentor some individuals yourself who are interested in a PhD program, Chidi. That was very, very well described. And I think I know that I said I was gonna be the last question, but what are your future plans? What are your interests in all of this? You know, what are your goals?
Yeah, so when I finish, I'm going back home. Um, my biggest, the most important thing that I want to do is teaching. Just want to go back and teach research methods and supervise students doing their research because I have quite a lot of research experience and I want to give back that to the next generation. So I believe that the only way I can contribute to my country's development is through teaching. So I'm going to take that journey of teaching. So yeah, so basically I'm doing this program to do research and teaching.
Amazing. Well, we hope to learn more about your journey when you finish. We do have the Black Male Professors interview series. So maybe we'll
Mm-hmm,
interview you after you finish your PhD and you are a professor back home in Zambia and having the impact that you would like to have. So
mm-hmm.
thank you again for all who have watched. And again, please, if you haven't subscribed, please subscribe to our channel so you can continue to receive exciting interviews like this one and learn about the different journeys of individuals who are completing their PhDs or maybe finishing their PhDs. So thank you very much, Chidi. Thank you very much, Hassim, and we'll see you all next time.